Hello, children. We are going to be discussing about the early childhood once again, which is from the age range 2 to 7, and it is also called the pre-operational stage. So, last time we, of course, discussed about the motor development, and this time we are going to be talking about the physical development of children who fall under the age of 2 to 7. So, to say the early childhood, which is the stage 2, or the pre-operational stage. So when we talk about the early development, and in case of the early childhood, it actually follows two very important principles. So one is, of course, the development is going to proceed in a cephalocaudally manner, and the second one is that the growth is going to proceed from the center of the body. You know so when we talk about the very first principle, which says that the development is going to be cephalocaudally. So what does the term cephalocaudally actually means? It means that how the development is going to take place right from the top, which is the head region, to the tail, which is also the caudal region. And the head region is also called the cephalic region. you know we have actually observed that how children, they start gaining control over the right at the upper part of their bodies before moving to the lower part of their body. So that's where the control comes first. And that is why we see that how when a baby is born, a newborn, or also to say the infant, their head region, it is so probably proportionately, it is larger than the rest of their body during the early infancy. you know and also they will actually use their arms first, and then they will probably shift to their legs. So they start using their arms much before they start using their legs. This is what we've seen in the infants. So it's very clear that how the development has started from the head and slowly it goes down. So this is what is the meaning of cephalocaudally. When we talk about the second aspect of development, which says that growth is going to proceed from the center of the body, and it's going to move towards the extremities. It's going to move probably to the distal areas, to the far off regions in the body, but definitely going to start from the very center, from the very core of the body. So this particular trend, if you see children, it's called the Proximo Distal trend, and they are going to be gaining control, you know, over their torso before they actually reach the extremities, or so to say, the probably the farthest reaches of their body. you know so firstly, it's going to start with the torso. So the torso, if you see, it is the trunk of the body. It is the part of that human body which is not including the head, which is not including the arms, which is not including the legs. So the part of the body other than the heads, other than the arms, legs, and the head, talks about the torso, or so to say the center or the core of the body. So Proximo Distal is talking that how the growth is going to start from the core of the body, or the center or the torso of the body, and then it's going to reach the extremities. So this is how we've also seen that how initially, the babies or the infants would reach out for their objects or for anything. They would actually turn their entire body, you know and then very slowly they probably start making use of their arms to reach out the objects. But initially it's just turning the entire body, because the entire, if you see, it is the center of the body, or the torso, where the growth actually starts. It starts, or it begins from there, and then it reaches to the extremities. And they are, of course, if you see these gradual changes which we start seeing, right from infancy to the early childhood, and slowly to the late childhood, these changes are coming because the nervous system is, it's growing, it's getting matured, and children, as in how they start growing up, we see that they start looking slimmer also, as in how they start gaining heights, we see the trunk part of their bodies, or so to say the core or the center, the torso of their body, other than their head, arms and legs, it sort of lengthens, it in a way elongates, and the fat of the body obviously is going to decrease. And the brain, and when we talk about also the head, it's also going to show growth, it's going to grow rapidly, as compared to the other parts of the body. And the growth and the development, if in we talk about the brain, it's important because it's helping in the so to say the development, or the growth, or the grooming, or the maturation of the abilities of a children. Many abilities are getting developed. If we see, the eye hand coordination, is getting developed, the holding of a pencil, the grip is getting developed, and even writing, all these things are getting developed, and it is somehow related to the growth, development, the maturation of the brain, and when we talk about the middle and the late childhood years, the children, if you see, they increase in size and even in terms of their strength. And if we talk about the weight is increasing because there is an increase in the skeletal and the muscular system, and of course even the body organs probably are increasing in size. So this is how the entire physical development is taking place. And because the brain is getting matured, because the brain is developing, so is their the gross motor skills, the fine motor skills, all these are getting developed, especially when we talk about the gross motor skills. Yes, definitely, these are also slowly getting developed in children, in this age group of between 2 to 7, where they can even jump, they can hop, and they can run, which we've already discussed in the motor development. So this was all about the physical development, where it's very very like in a very easy way, it's talked about the two aspects of cephalocaudally, and of course the proximo distal, and it's talked about how these two areas are going to be responsible for the development of a child, where it talks about from head to the tail, and then it talks about right from the center of the body to the extremities. So this was all about the physical development. Thank you so much.